Harish. I'm an associate professor in nephrology and I'm from Bangalore, India. With us, we have here today a very important person in the field of nephrology and transplantation. He is the professor in psychiatry and surgery at Harvard Medical School, and he is also the vice chair of research at Beth Israel Deaconess Medical Center, and he's also an advisory board member of American Transplant Society, so foundation. And it would definitely not be possible to find any of a book on living donors, any of the transplantation books, without a mention of his work on living donors. So I will take the liberty to call him as the James Bond of studies on living donors. So here with us, Professor James Rodrigue, fondly called as Dr. Professor Jim. Sir, thank you very much for joining us, and we extend a very warm welcome to you, sir.
Thank you very much for that kind introduction, and it's a pleasure to be here.
Thank you, sir. Sir, we would like to know a bit more about you in view of the upcoming your talk, one of the important talks which we'll be referring to in the next few minutes. So we would like to know a little more about you. And one of the most important and intriguing things for me is here being in India, we are actually like forced into one subject and more so into that particular subject. And but I find that you are involved in two departments, psychiatry and surgery, and that too surgical department being like, I feel they are disconnected with everything else. So how do you manage your work like that, sir?
Yeah, that's a great question. I do see myself as being at the intersection of surgical care of patients, the medical care of patients, and their psychological and behavioral health care. Many years ago when I first started in transplantation, there really were not any psychologists involved in the field. And so it was important for me to consider how I could integrate these two seemingly disparate fields of psychology and transplantation. And now we have many psychologists here in the United States, certainly, who are involved in transplantation and who split their time between psychiatry, psychology, and medicine.
Great, sir. Great. So you're trying to integrate things which are very difficult, and you achieved a lot in that manner. So the next thing, I would like to know is, for us, for me, definitely you are a very successful person. So we know you being a psychiatrist, I would just like to have an input from you. We all know that hard work is very important to achieve success in life, but there must be some other component which might be equally or more important. So can you please guide us regarding this?
That's a great question, and probably one that we could spend a couple of hours discussing over tea or coffee. I would say that there are probably three things that I've learned are particularly valuable throughout my career. And I've been in transplantation for 32 years and have mentored many physicians and surgeons over that time. I think the first is perpetual curiosity. I think that intellectual curiosity, whether it be in the clinical environment or in research activities, is really a gift that we're all given, and we should nurture it and cultivate it throughout our entire career. So maintaining that sense of curiosity, I think, is really critical and important in terms of one's definition of success. The second is mentorship. Throughout my career, I've been very fortunate to have a series of mentors, research mentors, clinical mentors, business mentors, people that I can discuss concerns or considerations around work-life balance. And so having a mentor that you can go to throughout your career, not just at the early stages of your career, I think is very important as well for success. And then the third is one that we often overlook, and that is selectivity. We are presented with so many opportunities in our respective fields. And it's impossible for us to take advantage of all those. And so we have to become really good at selecting those opportunities that we're going to pursue. And I feel that we do not still to this day do a very good job with our residents and fellows in training, teaching them how to say no to some of those opportunities. But in order to be successful over the long haul, you really do have to distinguish between those opportunities you will pursue and those you won't.
Great, sir. Great insight into that. So selectivity, then curiosity and mentorship. So I will try to remember this and inculcate. Great, sir. So even here in India, so and even in many other parts of the world, we keep. I know that you are working with living donors, so I just want to pose this question to you: that we keep hearing these stories of kidney theft. It's an accusation which is easily made, but difficult to prove and more difficult to disprove. So, what is your opinion on this?
So I can't comment specifically on accusations of kidney theft, other than to say that I can imagine that that's a particularly challenging and difficult position to be in if you're a surgeon or a nephrologist to have been accused of such. And I recognize the inherent problems that you just mentioned, that it's difficult to prove and difficult to disprove. I will say, and I certainly believe we agree on this, and that is kidney theft continues to be a major problem in some regions of the world, and we need to remain hypervigilant about it.
Okay. Thank you, sir. So, in continuation with that, we know that kidney theft accusations are not so uncommon. So, in order to overcome, I know your basic research field is the only same thing: unified and equal distribution, and to overcome the disparity that's been existing here. But some people, not that they are against this, but some people are they were towards this. Promoting paid donations, which should be in a regulated manner. So, what do you say about this?
Yeah, that's a great question. And as you know, there are many people who promote regulated paid donation and have published very specific guidelines on how that might proceed in certain countries. My own personal feeling about it is that we need to do everything we possibly can to achieve financial neutrality for living donors. I believe all of their out-of-pocket expenses, lost wages, lost income should be reimbursed so that the living donor is whole financially. And until such time that we can achieve financial neutrality, I personally don't think it's very productive for us to be discussing paid regulated donation.
Great, sir. Great. I think you just gave us an insight into your upcoming talk in the ISN WCN, that is about financial neutrality among living donors. So we are all eagerly looking forward to this talk. And really feel that this is going to be a talk which none of the nephrologists involved in transplantation should miss. So can you tell us what more to expect in your talk, sir?
Well, my talk in the end, just to give away the punchline here, is that we as a transplant community need to commit to making financial neutrality a reality for all living donors, regardless of where they live in the world. That really is what this talk is about. And for decades, we have known that living kidney donors in particular suffer, in some cases, very significant financial consequences from donation. Lost wages, medical expenses that are not reimbursed, travel expenses, and so forth. And while several countries have implemented reimbursement programs, many of these are insufficient in terms of their reimbursement levels, or they're fragmented, making it very difficult for donors to navigate. And so quite simply, my talk focuses on how living donors should not incur any costs to donate a kidney that benefits patients and society.
Right. So that would be the most insightful thing that we should learn about. And no matter however much we learn, there is always something to improve upon. So thank you very much, sir, for this opportunity to have you with us. So myself and Ms. Fernanda take this opportunity to thank you again for sparing your time, and we would be looking forward to for your talk at the upcoming ISN WCN. Ladies and gentlemen, so we have with us Dr. Jim Rodrigue, Professor Jim. So, and his talk is scheduled on 15th of April at 13:30 hours, and it is going to be a talk that is not to be missed. So please make a note in your calendar and be there. Thank you, sir. Thank you very much.
Thank you for the opportunity.